Hey guys, this video is going to be about exercises and treatment plans to help with pain on the outside of your thumb here. This can be sometimes called DeQuervain's tenosynovitis. DeQuervain's tenosynovitis is typically pain that is characterized or located on the base of your thumb. So this is usually irritation or inflammation of the tendons that connect to the thumb, and where if you extend your thumb out like this or just open up your hand, if you extend it out like this, you'll see it creates a little divot. So the sides of this divot is where the tendons are. They come from the forearm, and they literally allow you to do this on your thumb. So this is usually an overuse issue, and when this occurs, people usually report of pain kind of on this area. This is a structure called the anatomical snuff box, and that's usually where some of the carpal bones are, but it's important because this is essentially where you can access the tendons to help treat it. Typical presentations of DeQuervain's is usually complaints of, people usually talk about pain that's right over here with gripping activities, moving the thumb around, if you're typing a whole lot, if you are using any fine motor activities where you are writing, or anything that has to do with wrist motion, or any of the combination that I just mentioned. Sometimes, if it's irritated enough, you can even feel or see swelling in this anatomical snuff box region because of how irritated or inflamed the tendons are. Some of the clinical tests that I look for to confirm this as a diagnosis with DeQuervain's tenosynovitis, there's three things that I look for. So the first one is a test called a Finkelstein Test. The second one, I test the strength of the thumb in different positions. And then the last one, and I just poke around the thumbs, especially those tendons and in an anatomical snuff box to see whether it's tender or it's pain provocative. For the Finkelstein test, very straightforward. You basically take your hand, take your thumb, make a fist, grab it in, and then you turn it down. So this puts the tendon in a stretch position. If this provokes pain, or well, really your type of pain in the base of your thumb, kind of right around this area, that's a positive test. The second thing that I quickly look at is resisted thumb extension. So I have my patients extend and open up their palm. We'll really just extend their thumb and then make sure that you can see the tendons pop out or create an anatomical snuff box in this position. That means those muscles will engage. And I push in the opposite direction, just stressing those tendons. If that is also painful, that is also a positive test. Last but not least, I also poke around in the anatomical snuff box. So I have my patients bring it out, bring the thumb and extend it, and then I basically palpate around these areas, even in the snuff box itself, and I want to see whether I can elicit any pain by poking around these tendons, which then contributes to the extension or abduction, really just movements of the thumb. If all those three things are positive and the story matches up from what the patient is telling me, like they have pain right over in this area, they do a lot of repetitive movement activities like typing or anything that relates with gripping, grasping, and it kind of started with a presentation where they were doing a lot with the hand, then it matches with the testing, then it gives me more confidence to say that it is DeQuervain's tenosynovitis. For treatment, I typically recommend a brace first to keep the thumb in a neutral position, just so we can stop irritating it. Once we get the pain level down, then we can start moving the thumb in terms of strengthening it, giving it some mobility back, because the irritation in the sheath that's holding the tendon is really what we need to calm down. Once we kind of calm that down, then we can get things moving. So I'll put a link in the description below in terms of what I think the braces are good for this specific condition. So one of the first exercises I typically prescribe for my patients when I first see them for the first visit are something very basic and simple. I just give them thumb circles. So I have them doing about 20 times in a clockwise direction and then 20 times in a counterclockwise direction, making sure they get to the end range of their thumb. So you don't want to make your thumb circles super small. You want them super big because you want to engage all the muscles that are around it, including the tendons that were involved. For the next couple exercises, they're also pretty straightforward. You're just taking your wrists and you're going into ulnar deviation and radial deviation. So you're just going up and down with the wrists. So this is particularly helpful if you are in a lot of pain because of DeQuervain's, because then now you're just moving it up back and forth to try to get some of that swelling out, any of those irritating chemicals that are at the base of the thumb, just trying to get that out. Once you're comfortable with those exercises, then we move on to loading it. So when we load it, the exercises are exactly the same with the exception of an exercise I call thumb four-way. And the exercises for initially is you don't really load the circle, but you take a band that's like this. This is just a light TheraBand, a light resistant band. And you resist the thumb in different positions. You take the thumb and you extend it out. I usually have people do this about 10 times. And then you take it and you bring the thumb out this way, and then you bring it to your finger. Same thing, 10 times. And then you bring it out this way, and then you bring it towards your pinky. Same thing, 10 times. And then you bring it out this way, you apply the resistance backwards, and then you bring the thumb forward. So that's thumb four ways. Those are all the planes of motion of the thumb. So this works on all the muscles that are around it, including the tendons that are involved for DeQuervain's. Last couple exercises is resisted radial deviation and ulnar deviation. So for the resistance, you just grab a band like this. This is the same one I used at first. You step on it, so you can do resisted radial deviation, and you just grab it. So from here, make sure you start with your wrist all the way down, and then you're just going up. Slow and control. Anytime you're working tendon, you want to go slow and control. And again, you can do this for 10 times. And then for ulnar deviation, this one's a little weird. You actually have to turn your entire shoulder around, rest your elbow by your knee, and then you want to sit up a little bit so you can pre-tension the band, and then you can pull up into ulnar deviation, where you're going up that way. And again, you can just start with 10. That's all I have for DeQuervain's. Give these exercises a try. Let me know how they go. If you have any questions, leave them in the comment section below, and I'll see you guys in the next video. Thanks for watching.